I would love to take this conversation a little bit further and ask you, what are some of the current inequities that we see? Where are some of these communities that are facing those obstacles to access?
Yeah. So, when we're thinking about communities and how and who is most disproportionately impacted, and it really is important to gauge that conversation within proportions, right? Because that's really how we determine the equity piece. And another thing, when we talk about equity, we often confuse the word equity with this health equity with this other term, which is health disparities, right? We use those terms interchangeably. They are not the same thing. So when we talk about health disparities, we're talking about differences in health. We're talking about differences in health opportunities, and we're talking differences in health outcomes. Disparities, differences are measurable. They're objective. So I'll give you an example. In the United States, we have objective evidence to prove that African American women have a higher rate of maternal mortality than their white counterparts. That's a disparity, right? That's a difference. It's objective. We have the evidence to support that. Now, when we think about why, right, and we think about how we're going to fix that, then you start getting into conversations about equity, because we're talking about things like health insurance access, we're talking about health education, we're talking about systemic racism within healthcare. We're talking about sort of this, and then also predispositions to health conditions that worsen the likelihood of maternity outcomes, et cetera, right? And then how to fix those things become more of an equity conversation. So I just wanted to sort of, set that foundation. We're talking about disparities and equity, health equity. Those are two different pieces. One is objective and its differences, and one is more subjective, which is equity. And it tends to be more of a nuanced justice conversation. When we think about who is experiencing not just the disparities, but also the inequities, we are primarily talking about communities that are disproportionately experiencing poverty, and within the poverty landscape, we are also talking about disproportionately talking about communities of color. So very specifically, Black communities, very specifically Latinx communities, very specifically our Native communities, and some subsects of our Asian communities as well in this country. So, and those are facts. But I think what's also really important to note is when we talk about proportionality, we of course get to the communities of color discussion. But if we're talking about health disparities, there are incredibly high numbers, if we're just talking about volume, incredibly high numbers of Caucasian communities that are experiencing low socioeconomic status, that are experiencing really intense health disparities. And those are disproportionately burdened and shouldered by our rural white communities. So, I think that's really important, because I think sometimes this is an of color conversation. Just, we're talking about proportions. Yeah, we're definitely talking about communities of color, and especially poor communities of color. But we are also talking about Caucasian communities, especially poor Caucasian communities.